Hey guys, this is Dr. Olson, and I just want to take a moment on a Saturday and say hello, but also wanted to make a statement that don't be fooled by 24-hour permanent teeth. And I'm going to do a lot of videos to help support that claim, but right now there's a heavy push in the implant industry for full arch implant dentistry to try to do this permanent turnaround of 24 hours of permanent teeth on zirconia. And I know there's a lot of other professionals that agree with me, and we know that it's a marketing ploy, right? It's a marketing thing that these entities, these corporations that are trying to communicate to patients, hey, we can turn around permanent teeth in 24 hours. And then they go ahead and trash everybody who's doing it in what I would believe is a better way for patient care. And so I think it's time that we speak up and make our case that for our patients, right? For people. There's a lot of reviews that get buried on these corporations, and so it breaks my heart that people are getting kind of cheated over what I feel like would be the best. And I think there's a lot, like I said, a lot of other dentists. Please chime in the comment section. So why are you getting fooled by permanent teeth in 24 hours? There's three main reasons why this is an impossibility for most people. There's an occasional patient that it might work for. I'm not going to really get into that, but there's three main reasons why this is not what you want to do with your hard-earned money. I mean, this costs about as much as a vehicle does, right? It's a major surgery and it's on your face. And as implied, it's a permanent restoration that is something you have to live with. So I wanted to just take a few moments on my Saturday. It's kind of been burning me, and it's probably going to burn me the rest of my career, but there's three main things, okay? They both are related with static position and dynamic position. So static, fixed, dynamic, movement, right? So static would be fit, and then movement would be the feel. So that's reason number one. The second reason would be bite and function. So bite is the static, function is the movement. And then the third reason would be aesthetics and the smile. So aesthetics being the static and the smile being the movement or the function. Okay, I'll quickly go through those, but basically the fit and the feel. How in the world can you put something in the mouth that you just took out all their teeth, placed all these implants, and fit the gums and bone? And I'll just tell you, you can't. It's impossible. The gums and the tissue have to heal. Therefore, it's absolutely impossible to create a permanent set of teeth in 24 hours. And by the way, we can do that here at Innovative Dental. I can do that for patients. We just won't, right? So we can. It's not an impossibility. It's just not the standard of care that I believe patients should be getting. They're making a claim that it is the standard of care that people should be getting. And by the way, they're charging just as much, if not more, than what we charge and what a lot of other dentists charge. So this isn't just about Innovative Dental. This is about helping more patients. So hopefully you'll share this with friends and family. Maybe they've seen these corporations that are pushing 24-hour permanent teeth, zirconia permanent teeth. By the way, there's a lot of differences in zirconia. So anyways, back to the fit and feel, right? So why do we wait? Because we want the gums and the bone to heal. And so we can then assess the fit to the gums and recreate a teeth that fit the gums correctly and that feel correctly. Feel is subjective, right? Let's be honest, right? I put a set of teeth in your mouth and you're going to move around your tongue, your lips, your mouth. You're going to feel the difference, and you want to make sure it feels good to you. Not, I can just tell you, yeah, it feels good, right? No, you're going to want to go, yeah, it feels good, and you adapt to it. So fit and feel, number one. Number two on the reasons why you do not want permanent teeth in 24 hours would be the bite and the function. So the bite is the static. That's an easy thing to hit. Matter of fact, that is the only objective thing that can be done in 24 hours is hitting bite on both sides in the front. Technology's come so far, we can digitally do that, and we can nail that immediately, really. We do that. We put teeth in, by the way, within minutes of taking your teeth out. So within 30 minutes, we've got a screwed in set of teeth on your implants. You're leaving our office with teeth. Unlike these permanent teeth in 24 hours, you're not leaving the office with teeth. You're leaving the office with nothing, and then you're coming back the next day to get teeth. We want the dignity of all of our patients when we take their teeth out to actually leave with something nice screwed in on those implants that they can go heal with correctly. So, but back to that bite and function. So the bite can be nailed by anybody, even the permanent teeth in 24 hours. You can nail the bite where everything hits right, or hits even, I should say. But what we can't nail is function, because function is somewhat subjective, right? Your ability to eat, talk, the way it feels, intimacy, all of those, the way it feels in your mouth, your lips, your tongue, all of that is going to be, and when I'm talking about function, like movement, like using them, it's kind of like buying a car, right? You would never buy a car without a test drive. It's crazy to me that we're encouraging people to spend upwards of $40,000, $50,000, $60,000 and then go, well, you don't get a test drive. These are your permanents. Good luck. Hopefully you love them. Yay, they look good. And of course, a lot of these people are coming from a very rough smile. And so almost anything is going to look as an improvement. But that's not what we want. We want premium. We're not going for improvement. Improvement is easy. Doing something that looks premium and gives you long-term success and quality, that is challenging. That takes skill, takes a protocol. And obviously at Innovative Dental, we can help you, but that's besides the point. Okay, so we got the bite and the function. So the bite's the only thing that's objective that you can nail in 24 hours. The function, you need to be able to test drive it. And then the last one is aesthetics, right? The way that the teeth look just out of the mouth, right? If I'm holding these arches in my mouth that fit on your implants and I'm looking at them, I need to be able to assess, is there detail in it? Is there depth in them? And by the way, that's a monolithic zirconia versus layered zirconia, right? Those are gigantic differences in those two. If you want to learn more about that, watch our live implant webinar I host. I'll probably put the link below, but I host that every week on Thursdays at 3 o'clock. You can interact with me live and I'll go over all the details. But that's an important factor, is the monolithic versus layered zirconia. No one is doing really quality layered zirconia overnight. Just not happening. It's hard to get quality ceramists to want to work overnight and then try to cram in all of this detailed work on your permanent teeth to make them look extremely beautiful close up. So your aesthetics are going to suffer. And I would put Mareeth, our Innovative Tooth Fairy's quality of her prosthetics up against anybody in the industry. Shout out to you, Mareeth, Innovative Tooth Fairy. If you go to our Instagram or her Instagram page, Innovative Tooth Fairy, you'll see what we're talking about. You can look at all of the close-ups. By the way, you should always ask to feel and hold the teeth that you're going to be getting when you go and get your consultation. We make sure that every patient that comes to our office gets to feel these, because you need to know the quality of what you're getting. Are they out of China? Is there detail in it? Is it monolithic zirconia, meaning it doesn't have any layering of porcelain and it just looks really fake, right? It looks almost worse than dentures, okay? All right, so aesthetics and then smile. What do I mean by smile? Well, smiles are dynamic, right? Me talking, me smiling. It's all dynamic. There's movement, there's lip support. Moving your teeth forward on implants 1 millimeter is going to change how much teeth you see, right? So the smile is a dynamic movement. So even though I might in software think your smile is going to look good, I have no way to be certain until I screw them in and try them in. And so that's another reason why you do not want permanent teeth on implants in 24 hours. You want them to be tried in. You want to verify that you love them. You want to verify that fit your face, your lips, that you feel like it looks like you. There's a lot of subjectivity when it comes to smiles. I know how to objectively get your midline, get the cant, lip support. I know how to do that, and I'm skilled at that. Get your bite right, get the fit to your gums. But there's no way I can know exactly, do they feel right to you? Do they function right to you? And does your smile like fit you? Do you love it, right? There's a song that's, I think the phrase in it is, I don't like it, I love it. And that's exactly what we want our patients to feel like. We don't care if you like it. Liking your new set of teeth on implants. If you came from, a really rough, either dentures or your teeth are in bad shape, liking it is going to be a given, right? It's better. It's on implants. It's not coming in and out. It's not decayed. It doesn't hurt anymore. But loving it is not, right? We need prototype try-ins. We need to not rush people into permanent teeth in 24 hours. We need to give them the dignity that we would do it ourselves. There's one last point I'm going to make. Almost every dentist who's promising this, or surgeon promising this 24-hour turnaround permanent teeth, I can almost guarantee in a private discussion with them, they wouldn't want that for themselves. That should sum it up right there, right? That should make the whole case. They wouldn't want that type of treatment for themselves, especially when they're shelling out $30, $40, $50, $60,000. And so that kind of money being spent to be rushed into something that you didn't get a chance to test drive, approve, tweak a little bit to make sure it fits you and feels like you. I tell patients it needs to feel like a nice pair of jeans. We all know this. We get comfortable in certain pants. How much more should we be permanently comfortable in our new smile, right? So I know it's a little bit of a rant, for a Saturday, but trust me, do not be fooled by permanent teeth in 24 hours on implants. So All-On-4, All-On-6, full mouth reconstruction with dental implants, full mouth implant smile. Make sure you go to a dentist and a surgeon who's going to give you a chance to assess the fit and the feel, the bite and the function, and finally the aesthetics in your smile. You deserve the best. It is your future, your smile, you know, and your hard-earned money, quite frankly, that you're trusting somebody with. And so I just kind of felt like this was necessary. I'm going to do more on it, but you guys have an awesome, wonderful rest of the weekend. I'd love to see you in our live implant webinar. We host every Thursday at 3 o'clock. Cover all the details of how we do it here. I promise you're going to learn some things if you're looking to get it done even elsewhere. But, you know, I'm going to try to make the case for why you should travel to Springfield, Missouri and trust us here at Innovative Dental. But you guys have an awesome day. Taking long enough here. It's about 11 minutes. But you guys have a great day. Keep smiling. It looks good on you.